hypertensive, it's good that you seek help. It's good that you get to the hospital so that they can evaluate you and look at you very well. Because sometimes these risk factors we mentioned go hand in hand. Hypertension will be there, next thing to drag his brother diabetes, or they will drag the cholesterol one. You understand? They can drag all of them into one particular person, and when these risk factors combine, it's very devastating. It's very bad. It can destroy someone quickly and so fast. So it's important that you seek help in a hospital. You are evaluated, they look at you. The drugs is part of it, but that lifestyle modification is very, very, very important. It's very important that you adopt better lifestyle practices. If you don't do that, you are actually wasting your time when you are not adherent to lifestyle practices and medications. So we'll talk about the lifestyle practices. But I just remembered one classic problem that people come to the hospital with. This may be a good time to talk about it. Many patients I see in the hospital, I see in the clinic, and you ask them, are you hypertensive? They'll say maybe they are not sure, or they'll tell you no, or they say they had it sometime. Okay, no, they will tell me no. By the time I ask you, just think back many years ago. Was there a time they told you your BP was high? And they'll say yes. There was a time BP was high, and they gave them drugs, and they normalized, and no more. The BP was not there anymore. I believe in the first part of this lecture we did, I tried to tell you clearly that yes, hypertension have different types. There is the common type that happens in over 90% of people. There's more than 90% of the hypertension you see are of the primary type or essential hypertension. It's just telling you that this is a hypertension that you don't have a cause, it just comes up. And that's the one that is everywhere. And because it just comes up, you don't know the very cause of this hypertension. So if you don't know the very cause of this hypertension, it's difficult to treat it completely. Then the other percentage is the secondary hypertension, which you actually know the cause. Maybe somebody who from some other problem had a kidney disease, the BP will go up. So it's the kidney disease that is causing the hypertension. Somebody may have what they call thyroid disease, neck swelling, thyroid gland is producing plenty hormones, and the BP goes up. So of course, if you tackle the thyroid gland and the production of hormone that is causing the hypertension will go. So there are many secondary causes of hypertension, but in the grand scheme of things, if you look at everybody that is hypertensive, only very few fall into secondary. Majority are primary or essential hypertension. So when they tell you that you are hypertensive many years ago, and they just give you medications, you take it, you finish it, your BP is normal, you stop taking. This is the unfortunate story of most of the patients we see in the emergency. When they are coming back again, they are coming back with one of the cardiovascular diseases. They are coming back as stroke. You ask, why are there plenty stroke cases? This is exactly one of it. This person goes thinking that he is cured of the hypertension. He doesn't measure, he doesn't check, he doesn't take medications. He will just continue with his life and with his lifestyle practices, and eventually, when it now happens, one side of the body is paralyzed and they bring them as an emergency. Or the person will start swelling, leg will be swollen, face will be swollen. If they walk, they'll start, just get up and walk small, they'll start panting like they ran 100-meter race. That may be heart failure setting in. That may be kidney problem setting in. And that's the time they recognize again, after that first time many years ago, that they are hypertensive. This is so wrong. This is the reason for this channel. We've seen too many of these things that is heartbreaking. It's heartbreaking. Prevention is always better than cure. Taking 1 or 2 or 3 drugs regularly every day is way better than being admitted and taking up to 9-10 medications just to stay alive. That's not good at all. We want to meet people at the early stage when this hypertension is just identified, so that we tackle it early and these people don't come down with these complications. That's our heart desire. That's the essence of this channel. If you can pass the message, you can share it to people so that they will learn. When you are told the first time you are hypertensive and you are given drugs, these drugs they don't stay in your body for weeks. Many of them at best 1, 2, 3 days they are excreted from the body completely, and there is no more drug there. But of course, some of them that have a long stay, a long half-life in the body, by the time you take and you check the next day is fine, check the upper day is good. You don't assume that that's the cure. The drug may be lingering in the system for 1-2 days, but when the action and the drug is off the body, the blood pressure will start rising again if the person is hypertensive. So the person may not know, and hypertension, being a silent killer, may not give you clear signs that you have hypertension.